Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What does coughing up white mucus mean? Coughing up white mucus can mean you have congestion with a respiratory infection such as bronchitis, or it can be a symptom of long-term health issues like chronic obstructive pulmonary disease, COPD. The color of your mucus can suggest what is causing it, but not always. /r/n/r/n Your healthcare provider might ask you about the color of your mucus, but they usually can't diagnose you based on mucus color alone. They will also want to know about the consistency, thickness, and other characteristics of the mucus that you are coughing up. /r/n/r/n Illustration by Michela Buttignol for Verywell Health/r/n/r/n The function of mucus is to lubricate and protect delicate structures. It can trap small particles, such as germs and dust, making it easier for them to be safely removed from the body. /r/n/r/n White mucus can be caused by /r/n/r/n There are a number of potential causes of white mucus. /r/n/r/n Bronchitis is an inflammation of the airways in the lungs. The swelling contributes to the increased production of mucus. Bronchitis may be caused by a viral infection or by exposure to pollutants, such as cigarette smoke. /r/n/r/n If you have bronchitis, you may have other symptoms such as /r/n/r/n Bronchitis usually resolves on its own with rest and good hydration. Try using a humidifier to help relieve your symptoms. /r/n/r/n The development of a cough with white mucus could indicate that you are coming down with a cold or other viral respiratory infection, including the potentially serious respiratory syncytial virus, RSV. /r/n/r/n This type of infection usually affects the upper respiratory tract, including your lungs, throat, and sinuses. Influenza and COVID-19 are examples of viruses that cause this type of infection. Other symptoms may include /r/n/r/n Unlike illnesses that are caused by bacteria, viral respiratory infections cannot be treated with antibiotics. Instead, treatment is focused on helping your immune system fight the infection. /r/n/r/n Things you can do to help your body fight a viral infection that is causing a cough include getting plenty of rest, nourishing your body, and increasing your fluid intake. /r/n/r/n Using a cool mist humidifier and saline nasal sprays can help thin the mucus and make it easier to clear. Lozenges, cough drops, can also help relieve symptoms. /r/n/r/n Over-the-counter cough medicines are widely used, but there's still a lack of evidence that they are effective, and they may come with side effects. Cough and cold medicines should never be given to children ages 4 or under. Do not give cough or cold medicines to children ages 4 to 6 unless their healthcare provider tells you to. /r/n/r/n When you have asthma, your body may produce excess mucus, and swollen, inflamed tissues can slow its ability to FL out through the respiratory passageways. /r/n/r/n Other symptoms of asthma include /r/n/r/n Asthma can't be cured, but it can be managed with medication and the right treatment plan. Avoiding your triggers can also help you keep your asthma under control. /r/n/r/n Allergies can cause white phlegm, mucus, or phlegm that has no color. Allergy treatment can include taking an antihistamine, using a nasal steroid, or consulting with an allergy specialist. /r/n/r/n White mucus can also appear foamy or frothy if there are large amounts of air bubbles in it. A small amount of foamy white mucus is not usually a concern, however, coughing up a larger amount of foamy mucus can indicate a serious illness such as COPD. /r/n/r/n Other symptoms of COPD include /r/n/r/n COPD can be managed with short or long-acting bronchodilator inhalers. Your healthcare provider may prescribe a steroid inhaler if first-line treatments aren't working. Certain oral medications can also help. /r/n/r/n People with gastroesophageal reflux disease, GERD, may cough up foamy, white mucus. This usually occurs along with other symptoms such as /r/n/r/n if your cough is caused by GERD. Medications called proton pump inhibitors, PPIs, can be helpful. Also, try elevating your upper body while lying down to prevent reflux of stomach acid in the esophagus. /r/n/r/n Losing weight and changing your diet can also offer relief. Severe cases of GERD might require surgical intervention. /r/n/r/n Pulmonary edema causes fluid to build up in the lungs. This can make you cough up white or pink foamy mucus. Other symptoms of pulmonary edema include /r/n/r/n Pulmonary edema is considered a medical emergency, treated in the hospital with oxygen and medication. If you have any of these symptoms, seek emergency care right away. /r/n/r/n Sometimes, coughing can be a sign of heart failure. If you have a cardiac cough, you may cough up white mucus or mucus that is pink or blood-tinged. This type of cough doesn't resolve with time. /r/n/r/n Heart failure can't be reversed, but it can be managed with lifestyle changes, medication, and surgery. Following your healthcare provider's instructions can help improve your symptoms. /r/n/r/n Thick, white mucus can occur from dehydration. Increasing your fluid intake and using a cool mist humidifier next to your bed at night can help thin out your mucus and make it easier to clear. /r/n/r/n Depending on the underlying cause of your white mucus, you may be able to self-treat the excess mucus with home remedies. Otherwise, an OTC or prescription medication may be useful for your symptoms. /r/n/r/n If your mucus is caused by an infection or chronic condition, it's important to discuss your treatment options with a healthcare provider. Do not attempt to self-treat infections or other serious conditions with home remedies or OTC medications. /r/n/r/n These at-home treatments may help to relieve coughing and congestion. /r/n/r/n If home remedies are not enough to relieve congestion and clear your sinuses, consider OTC medications. Your healthcare provider also may prescribe medication. /r/n/r/n Some OTC congestion medications, like Sudafed triple action and Tylenol sinus severe congestion, are formulated with a combination of guaifenesin, acetaminophen, pseudoephedrine, or other active ingredients. Make sure to read drug labels carefully and never take more than one medication containing acetaminophen or another active ingredient at the same time. /r/n/r/n Most conditions that cause a cough with white mucus will go away with rest and self-care. If you have certain symptoms or your symptoms persist, however, call your healthcare provider. For example, /r/n/r/n If you cannot tell how much mucus you are coughing up, try spitting into a cup that you can measure and report this information to your healthcare provider. /r/n/r/n You might be able to have your healthcare provider assess your mucus production at an office visit. However, in some cases, they might want you to go to the emergency room for more urgent care. /r/n/r/n If you have any of these symptoms, call 911 or seek emergency care right away. /r/n/r/n The color and consistency of mucus can give your healthcare provider clues as to what is causing your cough. Besides white mucus, you may also have mucus that is /r/n/r/n White mucus may suggest certain conditions, but the color of your mucus alone is not a good diagnostic tool. Your healthcare provider may ask about color, but they may also take a sample of your mucus for a gram stain. This is a test that can help identify bacteria in your sputum. /r/n/r/n Coughing up white mucus has several possible causes. Your healthcare provider won't be able to figure out what is causing the mucus just by looking at it. In some cases, they might need to test a sample of the mucus to see if there are specific pathogens in it. /r/n/r/n If you are concerned about your coughing or mucus production, call your healthcare provider. While occasional white mucus is likely not a reason to worry, coughing up a lot of white mucus, mucus that has blood in it, or coughing up mucus when you also have other symptoms can be signs of a more serious condition. /r/n/r/n While symptomatic treatment of a cough can lessen discomfort, it's extremely important to understand the root cause if it is prolonged. Viral/bacterial infections, chronic respiratory and cardiac conditions, allergies, and GERD may all present similarly with a cough, but treatment differs greatly. It's imperative to have a medical evaluation to hasten recovery and prevent future episodes. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.